Well, our next speaker, shall I introduce you? No, that's Bert. Bert, honorary medical doctor. Congratulations, by the way.
So,
and let's hear about CLINAM.
Well, we went out one day 10 years ago, 11 years ago, and said it would be nice to do something in nanomedicine, and what we dreamt of was to make a worldwide network. And if you look now at the record of CLINAM, it's nice that we have 4,000 contacts, 2,500 have been within 10 years in Basel. So actually this is not so bad. I will try to say why we made a foundation. That was very easy. We just sat down and made a list of what is not existing. So what was not existing 10, 11 years ago, you go to Chalkidiki or to any conference, and the fact was that in this community you don't see any MDs. You just go there, pharmacologists, people who are, at the time the president was from Philips, and they said, I don't give a damn what's in my magnet resonance tomographer, but I want to sell it, so this is a good issue to sell it here because it's small. So we said, this is not how nanomedicine will start ever going to a market. And so we have founded this European Society for Nanomedicine. We have developed the International, meanwhile, which has a second summer school. We have created within the foundation the European Journal of Nanomedicine, and we have this annual summit, which is this time the 10th. So the structure is also that we have the Hunziker Lab, which we created 10 years ago, where we have several projects, one on malaria, including the dysgnosis one, cardiology, atherosclerosis, cancer, and personalized medicine. Personalized medicine in the sense that we also develop pathways to come to what are the enabling technologies and processes that you need for that. Then I took the projects for dissemination and the service providing of an information network, and I write the program, of course, and develop this conference which we have here. We have, these are the projects that we have created. So everything was very lean. We had no money in the beginning and tried always to realize this. Now, we think that the active engagement in Horizon projects is a good thing. Research at the CLINAM own labs and the interventions and schools, that is something which is very important. We went and go to schools with people between 17 and 19 and explain what nanomedicine is. Now, to give you a short history, because people always think that Feynman's has to do with this, but actually it was Paul Ehrlich who went to Maria von Weber's Magic Bullet opera, and he came to the conclusion that he had always dreamt, he was a Nobel laureate, of making bullets which would straight go to those organisms that they were aimed. So first idea of nanomedicine actually in 1954. Then you had Speiser, called Spee, in his time, who developed as the first one miniatured delivery parts. And Patrick Ouvreur, who is here and will have this afternoon a talk, was 1977 taking this over, and was the first one then to say that nanocapules in a new lysosomic carrier would go through the body. Then I missed one. Yes, I missed one. So 1995 only it was. Oh no. I have a problem. Can you help me to solve the problem? Okay, here is missing a slide which I have hidden. It is Alberto Gabizon and Gezi Barenholz, both members of CLINAM, who have developed 1995 Toxil, and that was actually one of the big starters to say a new nanotechnology era will open, and certainly nanomedicine is a big issue. So before I tell you about the summit contents, I will tell you that we see differently 10 years later how the role of nanomedicine has changed drastically, and I will afterwards tell why. So we had always speakers of excellence in our summit. The nice thing was that you can speak 10 minutes, and therefore the interventions are very short. You highlight something, but we give ample time for discussion, and at the same time we give nice surrounding, I think, good style for science, where you can have long debates like the last 4 evenings. I think you have seen that, what we do. So inviting the pioneers, I think, is very important. If you look what Jean-Marie Lehn, after 10 years after he opened the first conference and now told us, it was very fascinating how also Jean-Marie and his whole lab have drastically made progress from supramolecular to using nano on the nano level systems. So I think that the topic is if you look at it, we started just with 158 people, and this year this is less people, but I don't think the quality is less, the quality is even more. So if you look at that, and then maybe about the 18, I think that is important, because when I wrote this a few weeks ago, I started also to think, what are we going to do after 10 conferences? What are we going to do really after 10 years? And I think it's just a new concept, because these are then the cooperation projects. We have a very high record. If you go back, can I go back? Yes. If you go back, then you see you see there 4, 8, 7, 9. These are projects and corporations and startups. We have started up 7 companies, and all 7 are still existing. We have realized the biodegradable center was started in Basel. 4 European Union projects were started in Basel. So that is just that people get together and they talk. And you cannot Skype, and you cannot do telephone conferences, and you cannot do any video sessions and any WebEx where you really come to terms. I think people have to see each other, they have to smell each other, they have to I think intuition is a very big part of that, what you do when you start working and doing a project. Here are examples. I think I will stay short and look it up on the website, what we have done in the last years. I think, now it's over. So that's good that it's over, because then I can tell you, if you are looking through this conference, then you come to a conclusion that you say, is nanomedicine actually an enabling technology only, or is it really a known market? And we come to the conclusion that we say there is a market, it is like that, absolutely, but you have probably to see that any technology, I did 25 years ago CFD, no one knew what computational fluid dynamics is. And we started, and we were the biggest organization with about 1,000 people. And now you can go to Megastore and you buy the principal package for $100. So it's technology changes, and you don't talk about nanomedicine in 25 years. You will talk about probably nanotechnology in context of others. And nano has also the big problem, that if you would look at the latest products of Hoffmann-La Roche, then you have to say these are nano drugs, but they will never label them like that. So the question is the debate of translation the way we do it the right way, or is it just that we try to, I mean, take the word of Einstein, complex, make things simple, but not too simple. This, I think, is a very good thing. If you take complexity like a cup, and you throw the cup down on earth and it breaks, and you want to glue it together, you will always miss parts. So complexity, to crack complexity is very difficult. So what you can do is you can take several projects, and in the projects learn. Like Harald said, you can sum up, you can gain experience, and in the end you have to put it together. You have to take from different disciplines the factors that are in it. We believe that nanomedicine will change. We will also make a new concept.
Well, thank you, Bert. Let's give a hand. And, don't run away. You ask questions from the audience. Let's give the chance for the audience to ask questions for you. Please, question? Anybody? Anywhere? Anything?
You see, I knew no question.
No, I do have so many questions, I wouldn't fit the time. First of all, so it's a basics of business that once you have a brand name, you use it. So CLINAM, even it says the clinical nanomedicine, a lot of people don't even know what it means. They say CLINAM and whatever. During the
well,
talk,
but that was the idea.
Yeah, exactly. So it can actually broaden into
now it's
things once it. In my view, from the beginning, it has become a number one networking meeting, because really you just have time to disclose what you are doing, and then you rely on other people. So
well, but the success of CLINAM is probably due to the fact that it's very lively and people meet.
Yeah,
you have a high level of science, very good science, and you have at the other side, you meet all the pioneers, you have the youngsters have to interact with the older ones, and this is a fantastic concept. And the name CLINAM, I can tell you we did it on an app. We said, what is a good name? And we said, okay, it's clear. You have Syntef. Does anyone know what Syntef is?
No.
But you know that it's in the north, and that is one of the biggest centers that exists for technology. So we said, well, why not a name in the nanomedicine, like a word that anyone can pronounce, and you say it's clinical nanomedicine, CLINAM, full stop. And by now, go in the internet, we have about 38,000 verified links, and this is really preposterous. If 20 years ago we would have started this, it would have been very difficult to become world famous. But if you want to be world famous in internet, it's very easy. And if you have the first 100 pages are when you give in CLINAM are ours, then it's very easy. So this is the technology. But I think for dissemination, internet is good. But for the debates, I get ill always of these debates where you sit behind a screen, where you can show hardly something that is not shaking. These are not conferences where I think we take profit out as a humanity. No. And you want to do something for patient and humankind when you do nanomedicine. And it has negative aspects which are always discussed, and you have to go against it by saying, yeah, but we show what is good. And this is the problem we had yesterday with the regulators.
Okay. There's one last question over there with Sigmund. Sigurd.
Beat, do you see a chance, let's say, for clinical nanomedicine diagnostics?
I think that is a big market, the biggest at the moment.
And do you see a chance to implement such ideas also into your conference? Because I see myself as a diagnostic person a little bit.
We have thought of it.
We have thought of
it. We have thought a lot about it. I think.
Should have been coming 5 years now. That's absolutely part of it.
Yeah, we would have changed you. No, I mean, that is one of the questions, and I think the biggest problem we have is that there is no standardization. Like if you take an oral drug, you just say it's an oral drug. If you would declare this is nanotechnology inside, then people say I would not buy it. So you really have a problem there. And I cannot hear anymore these translation discussions where you always end up at the same bottleneck. I think we should be more inventious. We should be more spontaneous. We should discuss things positive, like Jean-Marie Lehn, who told about the crossing the street. But in the end, after his discussion, he said in a very small round that we were. Jean-Marie said, Beat, it's actually like that. If you have a car and the car rides over a person, then you will next morning in the journal have tragedy, the story of the man who died. Why don't we write 77,000 people crossed the street without getting hit? So that is the other way of looking at it. And I think in nanomedicine this is very much a discussion, worth a discussion. If you know that oral drugs are tested in India precautionary medicine is a huge problem, and it's a discussion worthwhile to discuss it from the view like yesterday, where's nanomedicine going from the regulations?
Thank you very much for that. Let's go hear about